So what's also exciting is that we now have a way of detecting minimal residual disease in these patients. So people have shown that the circulating tumor DNA, which is just a blood test, can actually predict who's going to recur. And in this kind of provocative study, it was not in colon, it was in lung cancer. They looked on post-operative day 3. So if you had evidence of circulating tumor DNA in your blood while you're still in the hospital, still recovering, you were significantly more likely to have the cancer come back on a chest X-ray or CT scan 2 years later. And what's interesting is in these patients, the ctDNA level goes down, but then it comes back up, almost as if the immune system is letting it start to grow again because it's not working properly. And here's another study in colon cancer patients, same thing. Very early after surgery, the circulating tumor DNA level goes up. But then by day 3, the day that we still see immune suppression in our patients, all of a sudden those that recur at 2 years, their ctDNA level is already going up. So what we hope to see in this study is that if we pre-treat and post-treat the patients with QB echo, could we make this orange dot go down to the gray dot in all patients?
As Rebecca has mentioned, we can assess in this study in the first few days after surgery 2 things: whether our treatment has restored innate immune function, particularly natural killer cells. Have we managed to prevent that profound immune suppression that occurs postoperatively? And the second thing, which is the more important thing from the patient's perspective, is can we show that our treatment makes it less likely to have circulating tumor DNA postoperatively? So within a few days of surgery, we can tell whether our treatment has been effective or not. Because if you do have circulating tumor DNA just days after surgery, it's almost 100% sure that you will go on to have a recurrence of your disease and die from it. So we don't have to wait 2 or 3 years until we know whether the surgery has been effective or not. And we're the only treatment currently, well, we're not a treatment yet, we're an experimental treatment, but there aren't any other treatments, to my knowledge, that can restore immune function. And as Rebecca was saying, there aren't any approved treatments that work in this context. And so it's a really important opportunity for us. If we show that it works in the context of stage 4 colon cancer, it has immediate implications much more broadly in cancer, because the majority of patients have surgery to in hopes of cure in the context of cancer. So if we're able to show QB echo is effective in this context, it has really important implications more broadly for surgery and for medicine, and obvious implications for cure.
Now, may I say 2 things? One, it's not about if, it's about when.
Thank you. Being a physician and a scientist, I'm not allowed to say those things, but no. Thank you for that, Chal.
No, the only thing I was going to say, like, as we are thinking positively here, so assuming that this trial together with Rebecca is going successfully, is there like a commercial pathway there?
Yes, thank you for that. Because in this context, there aren't any current treatments that have been shown to be effective. As Rebecca mentioned, sometimes chemotherapy is given, but there's the data suggests that there isn't any benefit to that. We can potentially get approval in that context through accelerated approval programs with just a single study. So we're designing the study with that intention, that potentially if we do get positive data, or in Shell's phrasing, when we do get positive data, then we may be able to move it forward to patients very quickly. Potentially, we could get approval with a single study.
I think how it's, from my point of view, it's so exciting because let's say when this study is demonstrates that this is effective, this is going to be the single biggest disruptor in cancer surgery in I don't know, as long as I can think, because if it's true that something stimulating the immune system around the time of surgery can improve outcomes, it has the potential to impact every cancer surgery patient. So in Canada alone, that's 65,000 patients a year who have surgery for cancer. That's a huge potential to improve patient outcomes. I mean, this is the Damocles sword for cancer patients, right? The surgeon took it out and they said it was all gone. But are they right? Is it all gone? And if we can change that ratio, that would be huge.